didn't know what I wanted to do, but I took an EMT course and I found a career that spoke to me.
It's only a one-semester program, so after this, I'll be able to find a job in the field.
The importance of an EMT program is to marry intensive training with the expectation that they will be operating at a professional level once they leave this course.
This is basically the first step to becoming a firefighter. It gives you the basics of all the emergency medicine, anatomy, physiology, pathology, and it really helps you understand what other careers can follow from this.
The great thing about the programs that we have at City College, not only can you learn about firefighting, you can learn about EMT, you can learn about paramedic, and they're all connected. Many fire departments around the Bay Area, around the state of California, will only hire you if you're an EMT. Well, we have a great EMT program and we can teach you how to be an EMT here. And then once you come in, some departments like Berkeley Fire Department will only hire you if you're a paramedic. Well, we have a paramedic program that you have access to as well. So all of those programs really complement each other so that we can help our students become qualified and compete with other students for a lot of these EMT jobs, paramedic jobs, and firefighting jobs.
Emergency medical services, it's a system of care. Emergency medical technician, paramedic, fire-based, whether it's a public safety agency that's providing first responders or emergency medical technicians or paramedic level EMS providers. Those are pre-hospital providers. That's one component of emergency medical services.
Are you guys ready? All right.
I really believe that to have really good emergency care for our society, for our community, it starts with pre-hospital. And so training EMTs is so important because we're all part of the wheel, and if we don't have an EMT or a paramedic or someone at EMS recognizing if they're sick and bringing them to me in the emergency room, it doesn't happen, and good care doesn't happen, and quality of life doesn't happen.
This field is a team effort, not only with your partner on the ambulance, but with the fire department and with law enforcement and other healthcare providers, and we're really the bridge between the two in the hospital and out of the hospitals.
Because of that hospital exposure, I find that a majority of those students go on and further their career as a registered nurse. Some have actually gone off and applied to medical school, and I have actually two previous students that are actually in medical school today. Some go off advanced practice nursing, whether it be nurse anesthetist, nurse practitioner. So there's so many different avenues.
I love teaching where students are curious, and then you can impart the knowledge to them, and those that really want to learn it, that you can be an influence, and they want more, and piquing their interest and just getting them going. And it's great to see the ones that make it into a paid department, and it's just like, wow, you succeeded, and it's a great feeling.
You're working with your team, and you're getting to put that. We've known my Alpha platoon for 5-6 months now, and it's you get to rely on them, and they rely on you, and it just feels really homey. It feels good.
I really have an interest in community paramedicine, just tying in my background in drug addiction treatment, working with people who are afflicted with mental illness and addiction, alcoholism, things like that.
Working together with law enforcement and with social workers and mental health workers and community health workers, the community paramedic will respond to calls that relate to behavioral issues and mental health issues, chronic mental health issues.
Sometimes an emergency is life or death, sometimes an emergency is someone's hungry and has no place to stay. You don't define the emergency, you just help whatever the emergency is, and being able to help someone no matter what the emergency is pretty selfless and a great feeling.
When we show up to someone's home at 3 o'clock in the morning and they're having the worst day of their life, I fall back on all the training that I've received over the years, whether it's through my academy as a San Francisco firefighter, whether it was through my EMT program or through the fire science program. Everything that I've done to get to this point has really helped me be able to show up and mitigate any hazards, make everyone's day a little bit better day in and day out.
It's never too late to start a new journey or a new path, and whatever you do, just do it 110% to the best of your ability and do it with integrity. And that's kind of like the motto of just try to do the right thing even when no one's looking.
Take an EMT class, volunteer, ask to do a ride-along, with your local fire department, your local ambulance agency. Come check out City College Classroom and take a look to see what it's for you.
You kind of just got to jump in and take that leap. Even if it doesn't really work out, I'm still in the process of figuring out if this is going to work out for me. But so far, I've loved every second of it.
Your instructors believe in you. All you have to do is believe in yourself. And I think if you do the work, you're going to get through it. Nobody wants you to fail here.
I'm super motivated and excited to continue doing this, and would love to, see more people getting involved.
It's a great place to start.